information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder of Aaron Seary, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by Big Pharma, by Big Food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands.
When government agencies hide data, it's not just about science, it's about money, power, and control. Today, we're pulling back the curtain on a Senate hearing where shocking claims surfaced. The CDC allegedly buried safety signals, whistleblowers were silenced, and billions of taxpayer dollars flowed into the hands of pharmaceutical giants while ordinary Americans were left in the dark. At Wealth Decode, we follow the money, and the money trail here is massive. From vaccine mandates that reshaped entire industries, to lawsuits that could cost billions, to the trust deficit now shaking Wall Street's confidence in Big Pharma, this isn't just health policy. This is economic warfare dressed up as science. And if the senator's allegations are true, it means the financial corruption runs deeper than anyone's admitting. So let's decode the wealth, the lies, and the power plays behind this hearing, because where there's smoke, there's usually money burning.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thank you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing in permanent subcommittee investigation on that hiding of the signal of myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data, and I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021. When I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because all the censorship during the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the, I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder of Aaron Seary, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by Big Pharma, by Big Food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta and Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
The letter I received from the Oshkosh business, it would be out of business because of the 50 employee mandate. It's going to be out of business. I just want to enter that in record.
When most people hear a Senate hearing on health policy, they tune out. It sounds like technical arguments over studies, data, and obscure medical jargon. But if you really listen closely, what you heard in this exchange wasn't just about vaccines or science. It was about money, massive amounts of it, and how that money moves through Washington, corporations, and ultimately your life. At Wealth Decode, that's always the lens we use. Follow the money. Because behind every scandal, every cover-up, and every political fight, there's always a financial story waiting to be exposed. The senator began by thanking Secretary Candy for testifying, but quickly turned the hearing into a brutal takedown of what he called corruption in federal health agencies. He pointed to over 8 million pages of documents his committee had already reviewed, claiming they reveal interagency communications showing the CDC admitted there was a myocarditis safety signal related to vaccines, and then deliberately hid it. If that allegation is true, it's not just a matter of poor science or sloppy communication. It's an intentional financial decision. The moment an agency acknowledges a safety risk, liability costs explode, lawsuits multiply, and billions of dollars in contracts and stock valuations are suddenly on the line. Burying that data, as the senator alleged, wasn't just about hiding the truth. It was about protecting corporate profits and shielding government institutions from financial fallout. In short, silence was money. He then turned to the VAERS system, which tracks vaccine adverse events. In 2020, it was praised as the gold standard of safety monitoring. But by 2021, when the data started to show troubling signals, the same agencies that promoted it suddenly discredited their own system. Why? Because the numbers were politically and financially inconvenient. The senator cited more than 30,000 reported deaths associated with COVID vaccines worldwide, with more than 9,000 occurring within 48 hours of a shot. Now, anyone who follows this space knows VAERS is complicated. Correlation doesn't mean causation, and reports don't automatically prove harm. But here's the real story. When results supported the narrative, the system was celebrated. When results threatened billions in contracts and the credibility of a trillion-dollar pharmaceutical industry, the system was attacked. This wasn't science being refined. It was narrative management designed to protect money flows. The senator then teased an upcoming hearing centered on a high-integrity study comparing vaccinated and unvaccinated populations. According to him, the results show vaccinated people are far more prone to chronic illness. If that holds up under scrutiny, this is more than just a bombshell for public health. It's an economic earthquake. Chronic illness is the backbone of the healthcare industry's business model. 90% of U.S. healthcare spending is tied to chronic disease management. Think about what that means. Long-term conditions are lucrative. They create lifelong customers for pharmaceutical companies, steady income for hospitals, and recurring revenue for insurers. If vaccines are shown to increase chronic illness, even marginally, then what we have is a system where illness isn't an unfortunate byproduct, it's the business model itself. The healthcare economy thrives not on curing disease, but on managing it for as long as possible, and every adverse effect becomes an annuity stream for the industry. The conversation then shifted toward a concept that should concern every taxpayer and investor: agency capture. The senator accused federal health agencies of being captured by the industries they regulate, and Secretary Candy agreed, saying restoring integrity to science was her top priority. Agency capture happens when regulators and corporations become so intertwined that oversight disappears. It happens through the revolving door of employment. One year a scientist is writing safety rules at the CDC, the next year they're cashing a paycheck from Pfizer. It happens when agencies rely on corporate funding or fees, making them financially dependent on the industries they're supposed to police. And it happens when research itself is monopolized by corporations, ensuring that studies never bite the hand that feeds them. This isn't corruption in the backroom bribery sense. It's structural corruption, built into the way the system functions. And for investors, it raises a crucial question. When a government agency approves a product, is it a scientific conclusion or just a shareholder press release with a government stamp? Secretary Candy then gave her own stunning example of how this plays out in practice. She recounted a 2002 CDC study conducted in Atlanta, which analyzed the timing of the MMR vaccine in children. The data allegedly showed that Black boys who received the vaccine on time had a 260% greater chance of being diagnosed with autism compared to those who received it later. According to a whistleblower, Dr. William Thompson, senior officials ordered him and other co-authors to destroy that data. The official published study erased the inconvenient result, and the public never saw the full picture. Again, think about the financial incentives here. Acknowledging such a racial disparity would have triggered lawsuits, destroyed vaccine confidence, and potentially forced massive oversight reforms. Instead, the data went into the shredder, and billions of dollars in vaccine revenue kept flowing uninterrupted. The decision to hide the data wasn't just about controlling science, it was about controlling money. This leads to perhaps the most critical point: the economic fallout of lost trust. If Americans stop believing in the CDC, FDA, or HHS, the consequences extend far beyond medicine. Healthcare is nearly 20% of U.S. GDP. The moment confidence collapses, ripple effects spread through the entire economy. Pharmaceutical stocks would become volatile, insurance companies would have to rethink actuarial models, and taxpayer-funded programs could face clawbacks or lawsuits demanding accountability. Even Wall Street would feel the shockwaves, because investor confidence is built on the idea that government regulators provide a reliable stamp of approval. If that stamp is tarnished, markets lose a key foundation of stability. But here's the paradox: even as trust collapses in one sector, new markets emerge in another. If people no longer trust mainstream healthcare, they'll turn to alternative medicine, supplements, wellness startups, and parallel systems outside the traditional model. Money doesn't disappear, it shifts, and those shifts represent both risks and opportunities for anyone paying attention. The senator also made a critical observation about censorship. He noted that when talk radio hosts tried to discuss VAERS data, they were deplatformed. At first glance, that looks like political suppression, but there's an economic layer here too. Big tech platforms depend heavily on advertising revenue, and pharmaceutical companies are among their biggest spenders. If Pfizer is running multi-million-dollar ad campaigns on YouTube, do you really think YouTube will allow content that undermines those ads? Of course not. Censorship wasn't just about protecting public health. It was about protecting revenue streams, preserving government contracts, and keeping advertisers happy. Free speech was sacrificed on the altar of corporate profit. So where does this all go from here? The senator promised that next Tuesday's hearing will unveil more evidence, including the chronic illness study. If that hearing delivers, we could see major market ripples. Pharma stocks could take a hit, insurance markets could wobble, and lawmakers could face pressure to reform how federal agencies operate. If the evidence fizzles, the government will double down on its safe and effective narrative. But either way, the trust crisis won't be resolved. Too many Americans already believe the system is rigged, and that perception alone has economic consequences. Long-term, this could force greater transparency, or it could accelerate the growth of alternative health economies that bypass traditional regulators altogether. For taxpayers, investors, and ordinary citizens, the takeaway is the same: follow the money. Who benefits from the narrative being pushed? Who profits from chronic illness? Who gains when censorship silences dissent? And who ultimately pays the bill when trust collapses? Because whether you're looking at federal budgets, Wall Street valuations, or the cost of your family's healthcare, the truth is that none of this debate is just about science. It's about economics, power, and profit. At the end of the day, this hearing wasn't business as usual. It was a public window into a system where the lines between regulator and corporation have blurred, where the flow of money dictates the flow of information, and where the health of the public is secondary to the health of balance sheets. If the senator is right, billions have been misallocated, critical data has been destroyed, and the agencies meant to protect us have been captured. If he's wrong, the government still faces a crisis of confidence that could take decades to repair. Either way, the money tells the story. And at Wealth Decode, that's what we'll keep following. Because in Washington, narratives may be spun and science may be bent, but the flow of money never lies.